Welcome, everyone. We'll just give another minute as board members join, and then I'll hand it over to Representative Dent to just get us started.
Here we go, right here. How's Nicholas doing?
Doing well, Mr. Representative Dent. How are you?
Good, good, good.
Good.
There it is. I found it.
Nicholas, can you give me rights to share my screen and I'll pull up the agenda for the day?
Yes, let me stop sharing my screen and believe you should have rights.
And I have the agenda in front of me too.
Oh, yeah,
Krista.
we do. Okay. I was just going to share it for. There we go. All right.
Well, we have like we have a fair amount of folks on. So it's 12:02, and Representative Tom Dent, I'd like to call the meeting to order. And why don't we begin with a roll call, Krista?
Sure thing. If board members, if you are here, please let me know when I call your name. Katie Byron.
Present.
Annie Blackledge. Justice Bobby Bridge.
Present.
Thank you. Ben DeHaan.
He's just joining.
Okay, thank you. Representative Tom Dent.
Here.
Sydney Forrester.
Yes.
Lonnie Greniger. Ruth Kagi.
Here.
Annie Lee. Dr. Diane Levy. Charles Loeffler. Lois Martin.
Present.
Thank you, Lois. Shonda Selivanoff, we know will not be able to join us today. Representative Tana Sen. You're still muted, Representative Sen. I see you talking. Okay. Senator Junie Warnick.
I'm here.
Thank you. And Ben DeHaan, I know you joined just to let us know that you're here.
Yes, I'm here. Thank you.
Thank you, Ben. And also, just so the board knows, if we have Assistant Attorney General Kristen Lamson on the call as well. Are you present?
Present. Thanks.
Thank you. Okay. Thank you very much. And I'll turn it back over to Representative Dent for any other additional comments before we jump into the actual report review.
Absolutely. Thank you, Krista, very much for the roll call, and thank everyone for being here today. It's going to be a pretty, I think it'll be an interesting meeting, but it's an important meeting as we go over our annual legislative draft report. So there's been a lot of work put into this from Krista and Nicholas, and I'm glad that everybody's here to help us go over it. And so hopefully this year we can have a draft report that's accepted by the governor's office. So the last minutes, I have to say that I'm delinquent. I did not read the minutes for our last meeting. But is there any additions, corrections, concerns over the minutes of the last meeting? Any board members? I'll take silence as good, and we'll just allow minutes to stand as submitted. So I'd like to turn the meeting over to Krista, and she will take us through the Oversight Board annual legislative draft that she's worked hours and hours upon, her and Nicholas both. And I won't tell you that I read all 11,000 plus words, but I read around 9,000 of them. So, and I appreciate the work that you put into it, Krista. And I am really interested in the presentation you're about to give us. So, Krista.
Thank you, Representative Dent. And I do want to thank all the members that have already submitted some feedback that has been incorporated into the draft. We had some additional feedback after I sent version 2 yesterday, and I have incorporated that into the draft that we will be reviewing today. So we will walk through this together. And as I shared with you, let me see if I can get this so where is that big enough for board members to read on the screen? I know this is the title page, so maybe I should go down to where there's some.
We're seeing your background.
Yeah, we just see
my
the
background.
aquarium.
Let me see. I will try this again. Thank you for that.
It's a pretty aquarium.
It's actually the Finding Nemo aquarium background. Thank you. Okay, can we see the report now when it says DCYF Oversight Board background? Okay.
Yes, it's perfect.
Is that large enough for board members to read it on the screen, or do we want me to zoom in anymore?
Well, it works for me, and I have pretty old eyes, so I think it's good.
Okay. So what I figured I would do is do a quick run through of how this report is slightly different than previous year's reports and why that is, and then walk through some of the basic principles. I shared this with you all in the emails received, just outlining what we did in this report. But then I thought as a group, as the board members, we could go through each outcome and just discuss them and clarify anything that's been added, clarify any questions about what's in there, and then really look for any additions or edits from board members as we walk through it. We only have 2 hours right now, so I'm going to try and make it as efficient as possible so we can cover all measures that are in here, but we will allow some time for additional, any additions to be submitted as far as requested edits after our review today. We do have a timeline that we want to get it submitted within about a week from Monday, including all edits as well as some additions to the executive summary and the co-chair letter. So we do have some additions to add, but I guess one thing I would like to, let me reshare something to start with so we understand where we're coming from as far as why this report is slightly different than previous reports. And that is, we just really want to ground ourselves in what's in the governing statute for the Oversight Board. So this is straight from our powers and mandates in our RCW 43216.015. And it clearly states that the annual report must review the department's progress towards meeting the stated performance measures and desired performance outcomes. So that's really the backbone of this report. And then also included a review of the department's strategic plan, policies, and rules. So earlier in this year, we did have an entire board review of the strategic plan and feedback, which is incorporated into this report. And the review of policy and rules, where appropriate, we can have and highlight throughout the different outcome measures that we will review. So just wanted to ground everybody in that we're really trying to be responsive to this mandate that's in our own, the board's governing statute, excuse me. So I will go back to the report now, and we will begin that walkthrough. So for the quick overview, what we did is we wanted to take their, as we've talked about in previous years and looked at, the establishing legislation for DCYF really does outline a number of outcome measures, which are essentially the intent of the creation of the agency to achieve these, or at least make progress on them. So we've numbered them just reflective of what's in that statute. We have, as we've done in past reports, taken the eliminate racial and ethnic disparities across all the continuum of care and made that number 1 as a priority, as the board has talked about for the past few years. So that's reflected here as well. And in this performance snapshot, we more or less wanted to provide a quick almost report card to say, how is DCYF doing in these areas, to be a quick reference. And then as we see throughout the report, we go into more detail to look at the data that's backing up this assessment of that performance status. And then any other commentary, particularly important, I found, was to identify where we have data either data lag analysis. So there are measures that are used, but to measure them well, it does take some time to do some look back. So we have data that might reflect outcomes for youth from 2017, but it takes 2 years to analyze that and get that information. So we have limitations in data in that regard. We have some data gaps, and then where we do have data, we try to assess based on what data points are available, how the agency is doing. So that was in reflection of any data prior to DCYF being in existence, and then since DCYF has been in existence. And just another part of this, I just want to remind the board, and I know everyone knows this very well, but as DCYF came into being, it came in parts. So JR did not officially join DCYF until July 2019. So there are some measures when we look at the JR space where we might have one data point to reflect when this has been under DCYF's authority versus some other before that. So that's something when we think about DCYF oversight, I think it's just very important that we do identify when DCYF has been in place and been the one that has authority over certain programs to really assess the agency's performance as we're mandated to do. So are there any questions about this performance snapshot before I move on into the actual outcome pages? Any questions about how this is designed, set up, or any of the decision-making around that?
Krista, this is Lois. I think that looks good. My only question for you is who, and I still wasn't clear after reading through everything, who decided on whether they were on track, needs improvement, or off track? What those rankings came directly from the department?
No, that came from me. That came from us looking at the data. So again, it's challenging because we don't have, for every single outcome measure, we don't have the same data for each outcome measure and reflective of the same years. So what we did was try and assess a trend based on what data was available since DCYF has existed or had the authority over a certain program. So again, so on track would indicate a increase in performance in an area for, we'll see like kindergarten readiness. So we've looked at that and we can see that we do have annual data points since DCYF has been responsible for this. And we do see a linear progression towards increasing that percentage of children entering kindergarten are considered ready in all 6 domains. There are other measures that we'll see. One that comes to mind is the rate of maltreatment in care, in which, because that it's a data lag analysis. So the most recent data point we have, I believe, is, I want to see 2018 or 2019. We'll have to look at it. I can't remember off the top of my head, but I think we only have one data point for that measure since DCYF has been administering the child welfare services. And so we were comparing that one data point trend since DCYF has been running those programs versus previous performance before DCYF was created. So it's not something that's scientifically, proven. It's more or less reflective of what trends we see in the data. And that's why it needs improvement and mixed. That's when we get a little bit more complicated, because some of these measures don't have one single data measure in existence that really covers the entire performance in that area. And so we have a few different data points we look at, and that can get to be a little bit more complex because it's not clear one way or another if it's either needs more additional work because things look rather like they're up and down and there's not a consistent trend in a positive manner, or some idiosyncrasies of data we're looking at suggest 2 different trends. Does that help clarify it, or is that?
It does. So then I think my question would be for the oversight board. And, when I look at the different categories that we're rating, there are some that we can easily see, like families being reunited or out of home care. Those are different data points that go directly into the department. But for instance, reduced length of stay, those type of things, we know that they come into the system and then they exit the system. But when I look at the metrics for kindergarten readiness or the increase in number of children in quality early learning, the data is just measured on those children that receive state services. There are no measurements around our other families, even though the mission of the department is to ensure that all children are kindergarten ready. So then my question would be for the oversight board, are we content with just having the measurement of children who receive grant monies or an ECAP from the state, or are we really concerned about all children or just children under the whose families receive assistance?
Block Kids is administered to all kindergartners coming into full day kindergarten. So it does measure progress for all children in the state coming into our public schools.
Right, public schools. And that's what I said, for those at public schools or receive services, that type of thing. But it says for all children. We don't have the data for private schools. So I'm just suggesting if we're okay with that, then we need to say that in the report, that this reflects public school and, you know, or just children where WA Kids is administered. That's my suggestion.
Yeah, that makes sense, Lois. And I think I understand what you want to do. And I think that personally, I think that would be a good addition, is to make sure that we communicate exactly where the data came from and what it represents.
Thank you, Representative Dent, as well as Ruth, for clarifying that. I know that. I just wanted to make sure that we as the Oversight Board are making it clear where the data is coming from, so that someone else, you know, looking at this will know that it is still limited, but we're hoping that at some point we'll be able to really include all Washington children. Because I just am concerned that, you know, there's the assumption that because a family is middle or upper class, that their children are doing well, but for BIPOC parents, that's not necessarily true in all areas.
So I also have a reflection on that, but I see that Representative Sen have your hand raised.
Yeah, thanks, Krista. Yeah, just if we're gonna make a note of it, I think as long as we make a note that that covers 95, 98% of the children. I mean, the number of kids in homeschooling or private school is not very high. So I think as long as we're clear that it's the most of Washington's children, and I'm not sure in the future, maybe interesting discussion, but I can't imagine that we're going to want to require you know, families who don't want to take WA Kids to take WA Kids, and that, you know, I don't think we're going to be expanding the requirement at any time. But anyway, I just want to make sure that we are also just showing that it is most kids.
Thank you. And I do want to just I hear you, Lois, and I think it'd be something we could put in a recommendation for that portion of the report when we get to it. I just want to say that we are reporting out on the measures that are in the legislation. And so it does specifically state that we need to assess DCYF and the number of proportion of children kindergarten ready as measured by the WA Kids assessment. So that is just we are required as a board to assess that performance, and that's why it's reflected here. But we can make in the section a recommendation to expand that beyond WA Kids too. We're reflecting what we're required to assess as well.
Yeah, or just, all I'm asking for is just a note that says that, so that way people, it's very clear, you know, that it doesn't include XYZ, even if it is a small number, they're still children, and we still should reflect that.
Okay. We will add a note when we get to that section. Is there anything else, any questions or comments on just the performance snapshot and what's included here? I did also want to add, we do have a few little asterisks to indicate some of the measures in here. So we do have the one asterisk just to indicate these are federal reporting measures, so that they're likely seen elsewhere. This is not anything completely novel. If anything, we've got a few more data points from DCYF a little earlier than they report them out. But there's some that is reported elsewhere with that. And then the double one is identifying when there's data lag limitations. I don't think I've gone through this thoroughly to identify all of them, but we have some of them here. So again, decreased juvenile recidivism rate. The most recent data point we have, I believe, is reflective of state fiscal year 2018, which is before DCYF when they had authority over JR itself. So we're acknowledging those limitations and more or less saying we can't make a statement on DCYF's performance based on this data simply because we don't know yet how recidivism has changed under DCYF's authority. So from that, just kind of initial performance snapshot, we do go into a summary statement on the Oversight Board strategic response to the agency's strategic plan. This was work that we did earlier in the year. There's nothing several times. So this is just an excerpt from that. And then we do have the full statement and response in the Appendix A of this report. So if anyone wants to read it more in detail, it is there. The one thing we didn't include, which is up to the board if it's an interest, we did do a little bit of an analysis to identify what the board's feedback was or was not incorporated into the final plan. We do have that table that I shared with the board earlier this year, but we have not included that in this report simply because, again, the report was asking for a review of the strategic plan and the board's response to that, which we have included.
This is Bobby. Krista, could you maybe just put an appendix in our forwarding letter regarding the strategic plan and then just incorporate it that way? Doesn't make the report any bigger, but if somebody wants to know what our input was, they can look.
So the input's there. So the input Appendix A, I was saying what's not there is after, and I actually think you requested it, Justice Bridge, was to know what in the board's response to the strategic plan was or was not incorporated. So that's a different document, but if you think that'd be valuable to have as an additional appendix, we can add that as well. Is that what you're?
Yeah.
Okay. So.
Sorry, are you suggesting adding the entire strategic report or just a modification to the letter saying this was adopted, check, this was not adopted, check?
Yeah,
Exactly.
the latter, yeah.
Thank you. So as we move into the first outcome measure, this is, again, this is listed last in the statute, but we've shifted it to first as we see it as priorities of board, and that's eliminating racial and ethnic disproportionality and disparities in systems involvement across child and youth outcomes in collaboration with other state agencies. The assessment here was needs improvement. So we know that there is work that the agency has committed to, particularly in their strategic plan and some other organizational structure changes in the past year, particularly with the establishment of the equity justice team and some other work that they're doing, particularly in data development to help really guideline this plan. So what we've provided here is to say it needs improvement. We've acknowledged the work that the agency has done and committed to. We've also identified the vast amount of work that the agency is working on to really align how they measure racial and ethnic disparities across all areas under their continuum of care, which is quite a bit of work, but they've done a lot to establish that. And then identified, which we have for each one of these outcome measures, contributing factors in future performance. So what we may think may contribute to improving performance in this area as we see things occur in the coming year or so, including impacts such as the pandemic and other needs and other legislation that may impact performance, and then recommendations. I do want in this one just highlight that the board strategic plan response, so what we just talked about in that previous section, and again in Appendix A, is very strong in its statements, commending the board or commending the agency for the commitment, but looking for much more bolder commitments in this space, especially ones that can be measured and accounted for. So that is what we have for this particular outcome measure. Are there any thoughts, edits, additions, reflections? Sydney?
So as I was reading the subparagraph there that starts with early learning, that first sentence, children who are Black are represented in subsidized childcare at nearly twice the, I think you mean rate, not degree, to which they make up the underlying income eligible population. In my mind, I tried to say, what is that saying? On the one hand, it sounds like it could be a good thing. It sounds like we're serving a lot of children who are Black in childcare at a rate greater than they appear in the population. So it sounds like a good thing, but it sounds like it also could not be a good thing. So I'm trying to understand, like, what do other people think about that?
I think it's a great observation. This is really summarized from the using data in DCYF to advance racial equity report. So this was coming from their work. I didn't put one way or another on it, but I'm open to, if the board wants to have any extra statements or perspective on that, I welcome it. But this was really summarizing from what was in that report as well. Any additional thoughts on Sydney's comment?
Representative Sydney, could you just repeat your comments? I had a little glitch here again, and sometimes I didn't catch everything you said, and I'm trying to get it straight in my mind.
Sure. Well, I'm also trying to understand if it sounds like it could be a good thing, but I'm not sure that it is. And I do feel like it's important to kind of understand what are the implications of this, but it's that first sentence following early learning where I think we're saying that Black children are being served in subsidized childcare settings at a higher rate than they appear in the income eligible population. I think that might be saying that there are many more Black children in that income eligible population, but I'm not sure if that's what it's saying, because it's talking about, it's comparing how many are served versus to how many are eligible. So I don't know that I need to, I think I do. I don't think for purposes of the report, I necessarily need to know if it's good or bad, but I think we all should understand that a little bit. And I'm not sure if I'm right in saying that it sounds like it's a positive thing, because it sounds like we're serving a good, like a really good proportion of children, but just raising it.
I can agree with you. It is kind of confusing. I'm not real sure what I'm reading there either. Sydney,
well,
thank you.
I would say this does come from the report that came out this year about understanding the data, and this is just my perspective too, is that maybe this is the beginning of understanding that work. So it's identifying when we're seeing the increase in data infrastructure to understand where disparities or disproportionalities exist. And that's where the agency is doing that diligent work. But then the next step is to identify maybe behind that, whether it's a good thing or a negative.
And right now, this is just a factual assertion, right?
Right. And that's where the agency, with this work and understanding the data and alignment across the continuum of care, is coming to see these factual statements and then trying, I think the next step is to do the work to figure out, well, what does that mean? So
Is it good or bad?
I think it might be maybe we need to add a statement saying that where do we go from here? And what does this mean? And some work into that. We can add that if that's of interest to the board. I also saw Ruth, did you have a comment or question? Ruth, you're on mute.
Well, that's what I was going to suggest, is that maybe in the recommendation, the Oversight Board will seek to understand the implications of the high representation of Black children in childcare. But just on the face of it, as I look at it, our goal is to provide high quality, affordable childcare. And if we're doing it for Black parents and children at twice the rate that they're in the population, I would think that would be a positive thing. But I think we need to get the department's perspective on why that is, and any concerns they have regarding it. It may have been a goal to really increase the utilization of working connections childcare by BIPOC children. So they should be complemented.
Ben DeHaan?
I think that because we've got it under the heading of disproportionate, some people confuse disproportionality with disparate treatment or disparate outcomes. And I think often people will see that disproportionality label and consider it a negative. And so if we don't clarify it, we run the risk of confusing people and creating a negative perception where one may not exist. So I'm just emphasizing the need to straighten it out and give it some context before we produce a report.
Thank you. And I'm writing notes for myself to follow up. So if they're not, full thoughts, I apologize, but it'll help me remember what the conversation was. Lois, did you have additional feedback and thoughts?
So I don't know if it's a positive that we have that many Black children in subsidized care, because when you look at the income levels that families meet to be able to even qualify, speaks to a bigger systemic problem than anything else. So I don't know if that's something we didn't necessarily want to jump up and down for. And then, the assumption is that because these are early achievers facilities based on the mandate that centers participate, doesn't necessarily equal quality either. So I don't see it as, I think the way that it is rated, the way you have it right now, Krista, is probably about accurate, with the hope that they can clear up and make it a little bit easier for those reading this to understand what DCYF, what their plan is going to be to combat that.
Thank you for that. So it sounds like we'll keep it maybe as that observation. I will do some follow-up with DCYF to see how it's being interpreted, if it has yet been interpreted, since again, this comes from a report from this year reflecting the advances they've made in the data collection. And then if we had the addition in the recommendations that we ourselves as a board will also seek to understand the true context and clarify what that disproportionality means. Does that feel like that covers everyone's thoughts around? Okay. Do we have any other thoughts on this outcome measure or what's covered? I do want to identify this. We don't have actual data charts for this one because there's so much data in this space. And obviously we're working with a report that we're trying to keep somewhat manageable, but there's a ton of data. And that's why we want to reference the work that the agency is doing to really make that data more consumable and better understand how the agency is performing across the board, and our hopes that in the coming year we'll have that. So we have more of the measures, we do have actual data, but because of that, there was just too much. It's a report itself to put in here, and I feel like that is a shortcoming of this, but it is a decision we made based on what we have to work with for a full report. So with that, we'll work the next outcome measures is where we walk into the early learning space. So this first one is about the Walk Kids assessment, as we talked about earlier. Here we do have data. This is from OSPI. So this is reflective of OSPI's report card. And for overall, for the state, we do see an consistent increase over the last few years. And with the highest percentage of the children being kindergarten ready last school year, not this current school year or the end of this current school year, but the school year before. We do want to make a note, and I believe we did in the COVID impacts, that OSPI, because of children being homeschooled and children not getting in-person Walk Kids assessment, they do have incomplete data for the 2020-21 school year. So we do have limitations in what we'll be able to look at in a future report on kindergarten readiness, but that is something we'll keep a good eye on as well to try and understand what those children experienced. And then additionally, we have this disaggregated by race, and we only looked at the last 5 years of data, again, to be reflective of when DCYF became the authority over this particular measure, and obviously with the early learning space. And we can see where there has been progress amongst most groups in the last couple years, and then where there's been some discrepancies in the past. So we have a little bit of context on explaining that and highlighting that. The Oversight Board's Early Childhood Development Outcome Subcommittee did look at this in depth earlier in the year, and we had a particularly valuable conversation looking at foster care outcomes for kindergarten readiness. So looking even further disaggregated by the youth in foster care versus non-foster care youth. And we saw some more disparate outcomes there, with a particular concern in the social emotional domain, showing that children in foster care were ranking much lower in their readiness in the social emotional domain versus their counterparts that were not in foster care. And again, we have contributed factors in future performance. So we look at the impacts of COVID-19, particularly with children being home, and also the impacts on the future data availability for this past year. We look at future reporting on this. So the one report that the Educational Research and Data Center did on the educational outcomes for youth in foster care that covered, really looked at that this aggregation with foster versus non-foster care and their kindergarten readiness scores. It was not an annual report. It was not mandated at the time to be annual. So we have the data, I believe, that is currently reflected is from 2017 cohort. Yeah, 2017 cohort. But there was recent legislation that has required ERDC to report on that for several years. So in the coming years, we will definitely be able to see more information on children, the outcomes for kindergarten readiness for foster care children versus non-foster care. Additionally, DCYF has talked to us in response to the board's feedback about doing further analysis also on youth that are in out-of-home care, their social emotional domain scores for kin versus non-kin placements. And so this is something that our board was interested in and thought there might be something to look into there. DCYF agrees. So the Office of Innovation, Alignment, and Accountability has put that on their research docket. So we should be getting more data in the future to see if there's also an element of kin versus non-kin on the social emotional domain development. And then we have identified recent legislation for the Fair Starts for Kids Act and how that might play a part in increasing kindergarten readiness in the years to come. And then we have recommendations. We got some feedback from this in writing from board members that I just want to call to attention. One is the two recommendations that got feedback. One was, and I appreciate any additional thoughts on how to phrase this or to capture this correctly, is that when DCYF gets the data on how kids are being assessed or whether they're kindergarten ready or not, that information is not always being relayed back to the early learning provider. And the belief is that that would be helpful information to work with those programs to identify where there's gaps or where there could be improvement in practice to ensure that those children entering kindergarten are ready to do so. So that was one recommendation that came out of the subcommittee. Another one was to identify that kindergarten readiness is not always as a standardized test served well by BIPOC children, that there are other meaningful measures for school readiness for BIPOC children, and that the department should take those not only into consideration, so doing a robust review of those, but also to then adopt them. And so we have that. I got additional feedback that OSPI with the STEM Alliance has some specific recommendations on that. And it was stated that it might be a good idea for the Oversight Board to also support to this recommendation. And I have quoted that here. This is from recommendations that were submitted to the Office of Financial Management in alliance with STEM and working with the OSPI. Representative Sten.
Evidently the EAOGOAC or whichever are the right initials on that committee.
Yeah.
Yes, also have recommendations on how to make WACKids more diverse, appropriate. And so it might be, and that report is already available, so that might be good to also reference. And it may very well have come from WACKids through EOGOAC, so it might be one in the same recommendations, but I think that would be helpful too.
Thank you. So I'll look into those. Are there other thoughts on this particular outcome measure and what's included? or not included if anything's missing. Ruth?
Thank you. Well, just looking at this, it is looking at the chart. It's the first time that that readiness measure has improved for all groups since I think WACIDS began. And given the investments the state has made in quality early learning, I think it's worth observing that that this is the
Uh-oh. Ruth froze. I will incorporate, I think she's saying it's worth to acknowledge that. I think we do. When we say that there's disparities between groups, but we don't acknowledge that all see improvement over time. So we will acknowledge that. Lois, did you have something else? Hope to get Ruth back here.
sorry, my platform is very unstable.
We got Ruth back. Ruth, so what I was hearing you say is you want to acknowledge that we're seeing an increase in kindergarten readiness across all groups by race and ethnicity, and acknowledging that, making a statement that we acknowledge that we're observing that trend. Is that correct?
Correct.
Okay, I will do that. And then Lois, did you have something to add?
For the recommendations, can we, with the group, agree to adding something, asking the department to look at maybe what other states are doing to be able to increase these numbers, especially among BIPOC students? I'm sure there's some that are outstanding, just to see what the national trend is and how we compare and what the plan is to increase our numbers for our BIPOC students.
Sorry, I'm having some real technical problems, and Lois, I couldn't hear what you said.
Lois, I mean, Ruth, you are kind of breaking up a little bit. I believe you just said that because of your technical difficulties, you're having a hard time hearing what Lois said. Lois recommended, and Lois, please correct me if I'm wrong, that we add have the agency look at what other states are doing in this area, where they've seen some really outstanding work, particularly in looking at how BIPOC children are being assessed for school readiness, and doing a review of that and how that can be adopted here. I think that might be a good addition to what we already have in here, which is to do a review of meaningful school readiness measures for BIPOC children, and then maybe we can add in that to do a state assessment or look at other states and what they've been doing in this area.
Yes, that's exactly right, Krista. Thank you.
Yes. Okay, any other thoughts on this outcome measure? Okay. Our next outcome measure is increasing the proportion of children in early learning programs that have achieved the level 3 or higher early achievers quality standard. So we've assessed this as on track because we can see over the last 3 years that this has increased for the number of children and percentage of children overall who are being served in a rating of 3 or above in the early achievers quality rating. So the first chart we just have is percentages. So we can clearly see at least a decrease in the percentages that are below the 3 rating. We also see a slight increase through the time of the pandemic of those who have not yet been rated. And that's reflected in the number of children here as well. Any edits we've made indicate that so the number of children being served in 3 rating or above has increased with impacts from COVID, but overall the number of children that are in a provider that's rating below 3 has definitely decreased. We see a backlog that has been created from the pandemic and acknowledge that. So in the contributing factors of future performance, we state that the COVID-19 impacts, and then we identify that the Fair Starts for Kids Act will continue to contribute to this, and in future years, we will see the impacts of that legislation and how DCYF has implemented it. Are there any thoughts or additions to this one? Lois, your hand's still up. Did you have a comment on this one?
No, my hand should be down. It's going
No
down.
Any other thoughts on this measure?
Yeah, Krista, so the recent legislation about the Fair Start for Kids Act, and absolutely, you know, I understand the intent of the legislation and the passion of everyone who is behind it. The only thing that I would say is, you know, it's intended to expand access to high quality childcare, because at the, you know, at the moment, our childcare situation is a little dire, and so not to put us in a spot if we're not able to expand access to high quality childcare, especially in the childcare, we could take some flack for that. Will expand, and I would prefer to see something like it is intended to expand, something like that. I don't want to put anybody in a spot, including myself and other colleagues.
I think that's a fair statement, particularly because we haven't seen it implemented nor been able to track the changes from it. So I think that's a fair
That's right.
statement.
And we're all hopeful that it does what it's intended to do. We truly are. So
For sure. Thank you. Any other additions to that? All right, rolling right on to number 4. So increasing the available supply of licensed childcare in both childcare centers, family homes, and including providers not receiving state subsidy. So I do want to say, so originally there was 2 charts in here. There was some discrepancies that were pointed out, and that the total number of licensed capacity were very different between the 2 charts. The first chart is calculating month by month, and it's a one-time count at the end of the month over the last year. This really, what I came to learn over the last 24 hours, this was calculated beginning of the pandemic. So this was something that DCYF has asked all providers to report their capacity. And that means it includes providers that are not enrolled in early achievers. The second chart that we had here that I have deleted, so it's not complete in what's in here right now, was reflective of the licensed capacity for programs that were enrolled in early achievers. So that's why there was an overall discrepancy in the total number, as well as this top chart includes school age programming, which obviously really took off during the pandemic as well. And the lower one included just the child care providers and family homes. So my question is, and I know there's a lot of dialogue box that I've put in here, and these are notes for myself. The question I have for the board is, the outcome measure itself is asking solely for capacity for child care centers and family homes. It's not asking for early achievers capacity. The previous measure was asking for quality, so the number of children served in providers that had quality rating. What we can do is we can incorporate the early achievers chart in here too, and we will make it very clear that the distinction between the 2 are all providers, including those not enrolled in this first chart. And then the second chart would include those that are enrolled in early achievers. The reason I just mentioned that there's a distinction to be made, and again, the comparison is slightly different, obviously, but since this first chart has only been, the department's only started to collect it since the pandemic, there is not historical data on this specific measure about overall open license capacity. They will continue to measure it from here on out. They've told me that, and that will be something that shows up on their performance page. So we will have data moving forward, but all the data we have to assess that performance is based on the time period during COVID. The chart that we can look at as far as license capacity for early achievers over the years, we do have annual counts by last day of each year for the last 4 years. So we can see a trend over the last 4 years. do we want to incorporate both of those and then have some context to describe the differences? Or do we want to stick strictly with just open capacity without the subtext of the early achievers enrollment, since this measure is just looking for open licensed capacity? Thoughts? And I will just state, I can show, well, I guess I'll stay with that. That's just the general question I will have before we go any further making decisions. Do we want to stay only with open capacity? And what data we have to look at that is under the COVID to see there is an increase, but obviously it's in response to the COVID pandemic when things were shut down. And or do we want to add looking at those trends for the early learning or early achievers enrolled license capacity, although that's not required in this outcome measure specifically.
Well, perhaps if it's not required, I'd probably lean not towards putting it in there. You know, not to confuse an issue. So, but I'm interested if anyone else has thoughts.
I think I would agree with Representative Dent.
Okay.
Yeah, this is Lois. I agree as well with Representative Dent.
Okay. Hearing from
Bobby, I do as well.
Thank you, Bobby. Okay. So we'll keep it to the one chart. It doesn't give us historical data, but it does give us at least an idea what's happened this last year. And again, DCYF plans to continue to collect this data and we'll report on it frequently. So we will have further data moving forward to see that capacity. So again, we have contributing factors similar. So COVID-19 impact and how that's changed the childcare industry. Recent legislation with the Fair Starts for Kids Act. I will make sure that this is reflective of language we had prior. About intent. And then we also reflect the Child Care Collaborative Task Force. As we've all acknowledged, there's been a great deal of work that has been done in that group and no need to be redundant or do additional work. And so reflecting some of the work and the strategy they provided and assuming maybe I should change this language, but intent to increase as well. Any other additional thoughts for this outcome?
Sorry, this is Annie. I'm slow on my clicking of my reactions. So, I mean, if folks are interested in recommending that an expanded kind of look at data, so you know that we sort of weaned it down to what's stated now as capacity, and you know usage might be the next thing that we could recommend that be tracked and followed, whether it's in that specific program category or overall.
So looking at recommending not only capacity but also need. Is that?
Well, does capacity equate with usage? I'm not sure.
Okay.
So there's sort of the question of how many slots are there, how many are being used, and then what's the outstanding need. So maybe it's a three-part thing.
I think another element of that is the geographic availability too, which gets to outstanding need, but also usage. So we can definitely add some of that in there. Any other additional thoughts on that addition? Okay. So now we transition into more the traditional quote unquote child welfare space. So the first measure on this is preventing child abuse and neglect. And this is one of the measures I think we're familiar with. It's complicated because there's so many aspects to this. So finding one measure to say whether or not abuse is being prevented or not is challenging unless we do a retrospective measure. So looking at overall the number of reports and intakes of maltreatment or neglect and the number of youth entering out of care. So we do report on that later in the report and we make a note of that, but we were trying to find a way to identify preventive measures and how we can measure that absent of seeing the later effect of that prevention. So with the data available, the board has talked some about FAR, so the family assessment response. So we do have a number of intakes that are screened in for FAR, and we see a trend that's gone downwards. Obviously, this note here that 2020, calendar year 2020 has quite a few less, is reflective of overall the trend in reduction in referrals during the pandemic, as we know was definitely a trend the agency saw. So we do I believe we make a statement about that. Yes, we do include language. I think I'll just make an extra note because I know that was a request to make a note that this is reflective of, in part, we believe, from the COVID impacts. And then we also have the family voluntary services, and we only have a couple years of data there, but we do see that the number, this is a little bit of a confusing measure, but the number of cases that are closed subsequent to a screened in CPS intake. So after working with family voluntary services, that there was a screened in CPS intake or placement is higher than what would be achievable. Yes, Ben, or what would be preferred?
We note subsequent CPS referrals with closure of voluntary cases. Do we also note the number of CPS referrals following a FAR intake? In other words, that were later referred to CPS, because without that, the number of FAR families really isn't very meaningful.
Thank you. I don't off the top of my head know if we have that, but I think it's a really good point, and that does provide the full picture more than what's provided here. So I'll look into that.
Yes, thank you.
I made as well.
And then similar, and some of these are, again, these are federal reporting measures, so they're not necessarily new information, but we could get about the timeliness of CPS investigations. We included where there was a target set and whether or not the agency, since the agency has been administering these programs, has exceeded or met that target. We do see they exceeded it. And then we saw that COVID had some impacts, even though there was still a higher rate of timeliness, but there was obviously challenges for the COVID impact on doing the response time. Yes, Ben?
In reflecting on something that Lois said earlier on, there are times when having out-of-state benchmarks or federal benchmarks would be very, very useful.
Mm-hmm.
And particularly in the federally required measures, there are national responses as well that can help us place our performance within some sort of context, because otherwise we really don't know if how well we're performing, because other than measuring our own performance in the past.
So,
So
that,
that's
are you seeking that as additional data to add, or are you seeking that as a recommendation for practice to compare to other?
I'm suggesting that we use that wherever there's a relevant and reliable measure, a comparator for our own performance. If there are national standards which exist, that we should let the reader know that.
Okay. Okay.
Does that make sense?
It does, yes. And I'm
For
curious-
example,
Yeah.
one good example of that would be the rise and fall of foster care levels. What we don't know is whether or not you're looking at a national trend or whether there's something very peculiar to Washington. It might even be a regional phenomenon and absolutely disconnected from any decisions that DCYF makes.
I see what you're saying. Okay. And Annie Lee.
Yeah, I have a question more around the data point and whether what it tells us about whether the department is achieving the preventing child abuse and neglect, since these are reports of like entry into or request of DCYF for services or an alarm is being raised. Is it really telling us whether or not the activity of DCYF is actually resulting in reducing child abuse and neglect? So I just am wondering about the data point and its really ability to answer that question.
I agree, and I appreciate that. And I think this is, again, one of the ones we don't have a specific measure that exists to say whether it's being prevented, other than trying to kind of web together some different data points to understand the full context. So we do state that here, and saying there's a review of measures that include the data that's here. So try to provide that context of when is there efforts to refer to FAR, or when, what's the exit outcome of families that are with family volunteer services. But then we do say that there are the retrospective measures. So again, the number of children entering out of home care, the percentage of children that re-enter care. We can look at those over time to see was more abuse prevented based on actions more upstream. But if there's that's the data that we currently have. I will say that if there are recommendations to how to measure preventing child abuse and neglect, I'm all ears. And I think it'd be a great recommendation to make to the agency and how we can suggest those prevention measures. A lot of what we have in this report is data that exists, obviously, and not empirically new data, because we just haven't had the bandwidth or skill to do that at this time. But if there is a measure that we would say this could identify whether prevention has occurred or not, I think that'd be a great recommendation to put in here, and we could do follow-up to build that out.
But it sounds like you're looking for causation, and we're never going to figure that out. In other words, was the action of the department the reason why there has been actions of the department, the reasons why there's lower rates of child abuse and neglect? I mean, we're never going to know that first.
And I think it's a good point, because it is something that the board is supposed to assess DCYF's performance in that area, since it's in statute, but it is a challenge to figure that out. So trying to use these proxy measures to the best of our ability to paint that picture, but it doesn't mean it's robust or complete. So suggestions there would be great. Charles, I know you've had your hand up for a few minutes.
Yeah, thanks. I had a similar question to Annie. I think kind of more specifically, some of these are a little bit more, I think, tuned into the prevention piece than others. So like, I think seeing the number of cases that have a new intake after we've closed out FVS or FAR, that can give you some information about a smaller population than the total child population of the state, but it is specific to the agency's actions and how they influence, at least for those kids, prevention of future maltreatment. But the timeliness of CPS investigations is entirely a responsive measure once those intakes come in. I don't know that the timeliness of the timeliness of CPS investigations might have impacts on things like heading off severe harm or something like that, but I don't know if that's necessarily directly related to this performance measure.
Thank you for that. Ben, did you have additional thoughts on that? You're still on mute, Ben, sorry.
I'm not sure we have enough time in today's meeting to really go into the limitations of some of these measures, but I agree with what Annie and Charles just said, that there's only a tenuous relationship between many of these measures and anything related to prevention. And that's the federal government's been roundly criticized for many, many years on that front. And it's been a real challenge in the entire field. So I do think that there are some options that we can consider asking DCYF to consider. I know for a fact, having had these conversations before, that we're going to run into the issue of data infrastructure, amount of funding, the ability to have people analyze the data, but it's certainly possible to get a better handle on measuring prevention than the data that we're using now. It's just a question of the practicality of getting people and resources to do it. In other words, we're making the best of what we have, but it's really tortured logic to think about some of these measures as having any relationship to prevention.
Thank you. And I think we all are in agreement with that. So Lois, I want to put out there, if there are ideas of, I agree with Ben, like, yes, we do, if we make recommendations, we run into that there might be capacity limitations, resource needs, and all that to do that data collection. I don't know if it's necessarily a bad thing to put out there if there are specific measures that we would believe would be more meaningful to start considering, because then DCYF has the chance to look at that and what that would take, and then pursue support for those resources and needs to do that. And I think I know the board's talked about in ways how we can play a part in helping support DCYF in that to be successful for the needs to do what we would like to see them do. So I think it might be beneficial to include in a recommendation if there is a certain measure or thoughts on how measures could be developed to better capture prevention. And then, yeah, and so that was my one thought. And then Lois, I wanted to call on you because I saw your hand is up for a couple minutes.
Yeah, thank you so much, Krista. I think for me, in reflecting on this and what Ben and Annie just said, is the point of, if we have data that's not really reflective of what's happening in the field, then we risk having everything continue status quo. And that's not helping our children or our families at all. So, I think that I believe that part of our recommendation should be for the department to come back and say what they need to make that happen. And, there are a number of legislators that are part of this group. We have a session coming up and can always champion for the department to meet that need. Otherwise, again, we're going to continue to have data that is not giving us what we really need to make changes for our children and families.
Thank you for that, Annie.
Yeah, I appreciate so much other folks on this committee who've better articulated what my initial, kind of thought was. I think the thing I would just add to the other really great comments is that the data point that DCYF offers up, I think, is going to be a reflection of their theory of change. In a way, and so without them sort of describing what they're trying to go after in terms of prevention, I think we lack sort of visibility of what their theory of change is and doing it. Otherwise, we're just reacting, right? I think to the calls, which I think that's what this data point suggests is we're reacting to a set of calls, but we don't really have a strategy or an indicator that tells us how we as an agency or a state are changing the dynamic of the current situation. So anyway, just thought I'd add that in.
I think that's really well said.
I do think that's a great addition. And so just to make sure what I'm capturing is accurate. So we're definitely want a much better way to measure prevention. And what I'm hearing is we want to know, one, the agency's theory of change for what prevention looks like. So we want clarity on that. And then are we also asking them how they plan to measure that? Or is we want the theory of change first to understand that and respond to that before asking for a measure? Or I know they also go in tandem. We want to, if there's a theory of change, you're going to be assumed to measure how you're making progress. So I just want to clarify if we're asking for both or one before the other, or if the board wants to respond to the first or so on and so forth.
I would say both. I mean, I think that, yeah.
So kind of accountability measures to that theory of change, or how they know it's going to work. Okay, Ben?
I would, I agree certainly with that we should measure both, but there's a broader issue at play here, and that's a conundrum the board's always faced, and that is what data should exist that doesn't. A good example of that might be the 40% of children for whom no visitation plan exists. There are critical things that are tied to child well-being that we need to know, and we don't know it for lots of different reasons. So it might be that we mention it in a report, but we also follow up with the agency around their own desire to measure prevention, because they've submitted a prevention plan to the feds. There are many reasons for them to want to know these things as well. So referencing it here should be the start, I think, of a longer term dialogue with agency leadership about what are the key things that we all agree we'd like to know, but we have no resources to gather that data, or we don't know how to do it.
Taking it just from a line report, but also doing some action with it as a board in a meeting and working with DCYF.
Yes, that's my point exactly. Thank you.
Thank you. Okay. Any other thoughts on that? I know there's a lot there to unpack, and I think that's valuable because it is one of the stickier ones, since it is one of the newer intents for the DCYF versus some of the previous organizational structures. Okay, so we're going to move on. I also just want to acknowledge, so we're at 1:13, we have time till 2 today. We're going to keep that timeline. So if we don't get through everything, I'm going to request that we do submit any additional feedback via email, and we as staff will coordinate and work with you all to make sure any of those are incorporated, or if there's any further discussion that needs to occur, that we're on the same page. So the next one is reducing number of children entering out of home care. This is a federal reporting measure, very straightforward. We do have the data that reflects what the outcome is requesting, and from what we've seen is that there has been a consistent trend since DCYF has been overseeing the number of children entering out of home care. I included the entering out of home care, as well as the number in out of home care, and that's just discrepancy that sometimes we see the total number of children in care, but also who's entering care. So there might be longer stays within the total number of children in care, but then we also want to look at the number that are entering. So we do see a consistent trend in both. I included also a racial and ethnic breakdown of the percentage of children in care for each year, so we could look at the changes by group. And some of the feedback I received from board members over time was to illustrate that some of those changes have different trends for different groups. So we do see an overall reduction of the percentage of the population for white youth, as well as I should just be reading my notes rather than trying to make sense of the chart in live time. But we did add context there to identify that we're seeing some trends over time for the proportion of the overall population out of home care by race and ethnicity. Because this is a priority measure in the strategic plan, I'd call that out, particularly since the board had some reflections on that, and added some additional context of other measures that play a part in the overall performance in this. So again, this is also connected to everything else, including prevention, but we did include that. And then, as always, contributing factors in future performance, particularly the COVID-19 pandemic. OIAA has acknowledged that the reduction in youth in care, particularly in this last year, they believe is correlated with the reduction in referrals to intake. So it's possible that we could see some changes in that in the coming years, and they do want to keep an eye on that as well. An additional comment was made also about the recent Supreme Court decision regarding ICWA and how that might change the number of children out of home care for Indian children. Charles.
So Krista, if we go back up here, you got a little ahead of me, but you're talking about racial equity and decreasing the number of children in out-of-home care. I lost a page number here.
Sorry, you want me to go up these ones?
No, it was below that, I think.
Oh, okay. The percentages.
Yeah, it's not it. Go down one more, see if it's there. Yeah, it's strategic and equity plan right in here. Okay, second paragraph. Prioritize reducing youth and out-of-home care equitably across race and ethnicity. So, the only thing I concern about when we decide to prioritize or pick on anybody is that maybe then we start making it work when it's maybe we shouldn't be. I mean, I understand we want to reduce the number of youth in out-of-home care, but we want to be fair to the children that need our help and our care. Does that make sense? I don't want to start seeing the agency maybe trying to meet goals, and I understand that, but when maybe we're not ready to meet the goal.
I do hear you on that, and that's reflected in the future measure about the number of children that re-enter care in 12 months. So that is something that in the board or the agency's strategic plan, they do talk about as a balancing indicator. So they want to make sure if we're trying to strive to make sure we're reducing the number of children entering care, that they're either not, we're not missing the youth that need that help, or families that need services, or that we're also not sending youth home that are going to show up in our care because we were not able to provide the services and needs at the time. And so putting them more at risk again. So that's reflected later on. I hear you on that part. If there's something in here that we want to rephrase that might suggest that this is reflective or just push the numbers to see a decrease, I'm happy obviously to edit anything in here. So I guess if you wanted something changed, what would you like to see reflected change in how that's stated?
I'll read it on it here, and if I come up with an idea, I'll share it with you. Thank you.
Sure. Charles.
I was gonna ask for that table with the percentages, because that is a focus for the department and for the board. I think it's a little. I'm just trying to think of the audience that's going to be reading this and how effective the report is going to be. And I see graphs on the page before, and I see, oh look, there's the line, it goes up, it comes down, and then on this one I see numbers and my vision blurs. I'm wondering if we could. Maybe it could be like a color code kind of thing as things go up and down, or if we can make a disproportionality chart like we did with some of the other measures. I think it might illustrate the point being made in the paragraph below.
So more or less make it more consumable is what you're saying. Make it easier to understand.
Yeah.
More consumable. Okay.
Yeah.
I hear you on that. And I did try, I looked at some line, making some line graphs on that. The problem is that there is so many little tiny discrepancies when the white population is 47%, but when we look at the American Indian and Alaskan Native percentages is 2.9%. The lines on one scale, it's very hard to differentiate that way, but I can get creative. I think there's possibly ways we could do even a heat graph to show trends across each group over time and be more quick to understand what's being communicated. So thank you for that feedback. I'll think through that. Thank you. We'll definitely make that change. Any other thoughts on this outcome measure or what's included? Senator Warnick, did you have something?
I do, and I unmuted myself before I raised my hand. So can we go back up to just below that chart right there? So I had to read that paragraph about 3 times to try to figure out what you were telling us. So the definition of multi, I guess.
Hmm.
Maybe, so that is a child that is, you know, of American Indian and another race. Is that what multi means?
Yeah, I believe so. I believe they're identifying as multiple races, but primarily would be identifying as American Indian and then as also having multiple identities. Yeah.
Okay, okay. And so, and I noticed there's a Black that's got multi, and then, okay. I'm just trying to figure out how we can make that more clear, I guess. Because I was reading that the consistent decrease over time, and then the very next sentence said consistent increase. So that's where I was trying to figure out what that meant. But the multis are increasing, but the population that don't show or don't identify as multi is decreasing. Is that's what
Yeah,
that's
I do.
correct?
I understand the confusion because there's a lot here. And I think similar to what Charles's recommendation is, there's a way that we could probably make this much more consumable in a visual format. So there's maybe this paragraph descriptive is not necessary. So we can look at it in a visual format so people understand. I think the importance to make is similar to kindergarten readiness, similar to what we've seen in juvenile detention and JR populations, which is even though the overall number of children might be decreasing, it's important to see that that might mean there's a great increase in one racial ethnic group than another. That's something in juvenile detention we've seen and JR, where we want to celebrate that there's less children, but then if we see that it's impacting one group over another, we want to really pay attention to that, make sure that we're doing everything we can to mitigate that as well. So I hear from multiple people to simplify this and make it easier to understand where those trends are happening. So the overall reduction isn't just taken for a celebratory statement. Ben.
Yeah, I appreciate that. And sometimes less words and more graphs is better for people like me. Thank you.
No problem. Thank you, Senator Warnick. Ben.
When I saw that graph, it just made me realize how blunt an instrument the 50% reduction goal is. Because what does that actually mean? If we can somehow encourage that goal to be parsed out a little more carefully to address the specific disproportionate reductions that we see in this chart, that would be very good. Because is DCYF saying that they're going to reduce 50% of each of those categories? Or is most of the 50% going to occur with only white kids? I mean, no one's really ever expressed that. And if it could be coupled with some statement about what the right size of the foster care system should be, why are we assuming that we are placing children at twice the rate that they should be placed in the state of Washington? Because that's what that goal says. And I don't know how we concluded that. So anyway, though, if we can, I can give you some language, probably better than taking up our time here on that point. I'll write it out in an email.
I think that'd be great. I think clarifying that, and you're right, we haven't heard that from DCYF specifically on what that 50% reduction actually means. But yeah, some language around that would be perfect, and we can put that in the recommendations portion. And as you said, yeah, just some understanding of where that goal came from in the first place. Representative Sen.
Thanks, Krista. The sentence right below the confusing chart says that given the decrease in the absolute number, disaggregated data by race and ethnicity indicates the reduction is occurring at a different rate for each group. True, and because I guess a reduction could be positive, or I mean, it could be a negative reduction, meaning like there's actually some groups where it has increased. And so I don't, whether if you take out that next paragraph or not, frankly, I do think it's important to put into words that the white population in out-of-home placement has decreased, but in general, all other kids of color has increased. I mean, it's not just that the reduction rates are different, but in most of these categories, it has increased or stayed the same, but there have been increases. And so I just want to make sure that we don't brush that under the rug. It's not that the reductions are different, you know, are smaller. Some of them are, significant number of them are increases. So I don't want us to lose that observation.
Thank you for that. And I think that helps me. I think I was trying to use this to explain the above chart, knowing that it is too much data overload. So there's ways we can simplify the visualization and then add that additional context to make sure we call that out without having to explain what's in the chart itself. So thank you for that. I think that's good feedback. Ruth?
Thank you. There's a statement in here that the number of CPS referrals has been reduced because of the lack of eyes on children, basically. And I just, Ben, do you have any insights on that? I mean, we don't know that it's directly related to the fact that that teachers and doctors are not seeing children. We can presume that, but I'm wondering about making that statement if we don't have a real factual basis for it.
I feel exactly the same way, Ruth, and that is that these two things occupy the same point in time, the pandemic and the reduction, but we don't know if they're related. And the other thing is that we don't know what the impact of all this is. You would expect more children to be seriously injured or at least show up in emergency rooms or something with a dramatic reduction in referrals, but no one substantiated that yet. So we really don't know, even if they are related, what the impact on children would be. It would be a real shock to a lot of people if you could dramatically reduce the referral rate and have no discernible effect on the safety of children. It's an open question. We don't know.
So should we, I think we probably want to keep a COVID pandemic impact here, but maybe what the statement should say is we don't know what that impact is of yet, if any, on this population, but we will pay attention to.
Well, what we do know is that a large chunk of the referrals come from schools, and if children aren't in schools, those mandatory reporters aren't witnessing anything to report. I mean, that much is probably true. But I wouldn't go any further than that.
Okay. So I will make a note to make an adjustment to that. We know that the school exposure for sure potentially, well, we'll make a statement that we know the reduction of mandatory reporters being able to see children at schools may have an impact on this overall decrease in children entering out of home care.
As I recall, I haven't looked at it lately, but as I recall, there was a pretty steep, and Charles might have more information about this, there was a pretty steep incline in the raw referral rate. And we were predicting it was going to get up to about 140,000 a year. And so it is radically different now than what the trend line was showing us. I just think we need to really see how that washes out in terms of injuries to children. There are some people who are studying that right now at USC and other places.
Did you have a comment, Representative Dent?
You know, I was just trying to listen to Ben there and think my way through this. And I don't think we have an answer, so I'll just, never mind, thank you.
Justice Bridge?
I don't know if you're ready for me yet. I wanted to comment on the Supreme Court decisions. pet piece, which is next. Are you ready for that yet or not? I think not.
I am, yes, I'll just add a few dots, I'll go back and figure it out. Okay, so the Supreme, oh, down here, yes.
Yeah, again, I won't take time either to wordsmith, and I should have done it beforehand, but I don't know what multiple decisions you're talking about with respect to ICWA and WICWA. There's one, which is a biggie, and it's the one authored by Justice Montoya Lewis. But these are not enhanced policies. They are interpretation of statutory requirements. And so I just think it needs a little work, and maybe even a couple of words, not to add, bulk to it, but to indicate what the thrust was. Other than the Supreme Court's going to make us do something that's going to potentially reduce the number of tribal children in out-of-home care.
And as far as the multiple decisions, the two were the reason to know, and then active efforts were the two that were distinct.
Active efforts was Montoya Lewis's one. Yeah.
Okay. So I'll pin you for some clarity on that language and follow up on that.
Okay, thank you.
Thank you. Lois.
I just want to thank everyone on their comments, especially Ben. And I was just thinking about the work they're doing at USC, and maybe for recommendations to ask the department can probably check in with some of when we're looking at the number of cases that may have been reported, and we know that, we don't have the schools, but I'm thinking we do probably have data from Children's Hospital or from either Seattle, Tacoma, across the state, and they may have some interesting data that the department can look up to see if the numbers have really gone down, or is it really flat, which is what I think, Ben, you're thinking, that there's more to it. Am I right about that?
Well, we really don't know. We actually, at the School of Social Work at UW, actually started a risk of injury study when the pandemic began. And we recently, or in the process now, transferring it down to USC because they're better positioned to do it on a regional basis than we are. There is data, and Rebecca Rebbe, who is a former employee with us, is down at USC now working on that. So she does have some preliminary results, as I understand it, but I don't think they'll be specific to Washington. This is a hot topic in the child welfare field, and I think we're going to see a lot of research related to it because it's a naturally occurring experiment, a negative one, of course, but it's still naturally occurring. So we'll learn more, and people are working on it right now.
So Lois, did you still want to?
No, I'm putting my hand down. Thank you for clarifying that, Ben.
Did we want to add
You're
anything
welcome.
about expecting DCYF to follow up on that data, or do we think that that's an implicit expectation?
I'd have to give that some thought because it is it's a radically different approach to thinking about child welfare issues and then reducing it to injury. There's also, we can't talk about it, I'm sorry taking up so much time, but there's also a lot of thought that children who have been abused and have sustained injuries aren't being taken to emergency rooms because they're mandatory reporters. So it's a sticky wicket. I'd have to think about it before making a recommendation to the agency.
Sure. I'll just leave, I'll put a note that I'll follow up with you if there's any additional thoughts on what that recommendation may or may not be. Otherwise, we won't include it at this time.
And I can check in to see what the status of the research is now on the injury side.
Okay, so we'll move on to the next one. Reducing length of stay for youth in out-of-home care. This is again a federal report, federal reporting measure. So we do see a reduction since DCYF has taken over the administration of child welfare and out-of-home care. This one, there wasn't much to add on this context, I believe, because one, the board has not had an extensive conversation about this measure, but additionally, as a federal reporting measure, there wasn't a ton of context. I will say again, this is one of the lagged analysis measures, so they do look at, obviously they need a certain amount of time to assess whether our youth is still in care and their length of stay. So the most recent data point we have is from 2019, state fiscal year 2019, or federal fiscal year 2019, I believe. I apologize. No, I think it's state fiscal year is what my notes say. The only contributing factor we've added is with COVID-19. Maybe not. I apologize. I'm trying to read my writing in as we're going through it. Oh, we say the contributing factor is the connection with the number of youth entering care, and that even though, again, that there might be less children entering care, it does not mean that the children in care are having shorter stays. So there is something to continue to monitor and talk about placement options as part of that. Is there any thoughts or additions to be made to this? It's a shorter one. Ben, yeah.
Oh, I'm sorry, I didn't raise my hand. Washington has a disproportionate number of short stayers. And I haven't looked at it for a long time, but basically what it means is that there's a flurry of activity with short stayers that can artificially reduce the length of stay, but there are many children that have very, very long stays. And separating that out more clearly would be a benefit. I don't know if we need to do it for the report, but length of stay is also a very broad measure that can mask individual effects on certain groups. And one of them that we know about are the quote deep end children who end up in hotels and others. But there are, I'm going to bet, disproportionate lengths of stay for BIPOC children, and you'll see a lot of that activity with short stayers masking that effect.
Thank you for that. And we did, I was checking, I knew it was in the source, but I guess I did include it too, that this does not include stays less than 7 days. So this calculation does not include that, but it does include child return home for up to a maximum of 30 days. So,
and I think it would include also 7 to 30 day stays. And there are proportionately a large number of children who stay for just a few weeks.
So is that a recommendation that we should be looking at this in a more disaggregated manner as far as?
I'm wondering, I don't know if the agency is looking at it and reporting it out more specifically. It's probably Vicky would, maybe a follow-up with Vicky before we release the report to see if they do have a sharper analysis of that.
And it sounds like by race and ethnicity, but also about maybe terms of stay. So if they broke it down into smaller categories of length. Okay, got it.
Yes.
I'll check with.
Exactly.
Okay, I will check with Vicky on that. And if it's not, I will make sure we have that reflected in our recommendations.
Okay, very good. Thank you.
Thank you. All right, I know we're running shorter on time, so I don't mean to speed us through, but hoping to cover as much as we can. So any other thoughts or additions on that one? Okay, moving on. So we have reducing maltreatment in youth while in out-of-home care. So this is one of the ones that's off track, but it is based on 2 points of data. And this is the increase in founded reports of maltreatment in out-of-home care. So since DCYF has been overseeing this, we have seen an increase. in that rate. Again, this is another category that the board has not talked about in length or in depth, so it's a very short review of this. There was a recommendation from a board member to add the COVID-19 impacts, just to identify that there has been research about the additional stressors on families and how COVID has increased that. Again, this is for children that are in out of home care though, so it does mean also for providers or caregivers. But there was a request to add that. Katie, you have some thoughts, feedback?
Thank you. Is this also looked at as rate per individuals? Because I see it's rate per 100,000 days in care, but I would be interested in how that correlates with individuals.
As far as race and ethnicity breakdown, is that what you're?
Right, and like, is it multiple? I guess I'm having a hard time visualizing rate per 100,000 days, how that correlates to individuals, because it's looking at just a whole bunch of days in care, and it could potentially be one child who was victimized multiple days,
right,
or multiple children victimized in multiple placements. I'm having a hard time understanding exactly how to wrap my brain around that.
Yeah. Is it a few children, but multiple incidents of the same children experiencing that are representing this rate, or is it more of a widespread pattern that more children are being maltreated in out of home care? Okay, I think that makes sense to clarify that. And this is a federal reporting measure, so this is what is often reported out on, but I can do the same as our previous one and follow up with DCYF and see if they are looking at it in that way, if there's other ways to conceptualize this measure. Any other?
It seems like the 100,000 days would be kind of accounting for an exposure measure, like how long a child is, children in general are in, and, like Kate said, like, is a child being abused multiple times? And like, I don't know. I feel like we as a board might be more interested in how many children are victimized at all, and less in how many days any children were victimized. I don't know if that's what this exactly is measuring. I'm not sure how this is calculated, but it might be easier to understand too as far as the consumability of this report.
For sure. I think it's a good thoughtful reflection on what this means and what it's aiming towards. I believe, and correct me if I'm wrong, I see Ben's hand up, so I'll definitely have Ben chime in. That is to see that if we are placing children in care, that they are not being harmed, or that harm is not occurring or increasing by that placement. So, Ben?
I think this is a typical example of a federal measure that's being used to try and deal with very small, infrequent occurrences at the local level. The reason the feds calculate it by those days is they want to be able to compare and contrast states' performance with dramatically different numbers of children in care, where you have to compare Wyoming to Los Angeles, for example. So it doesn't really fit for our purposes. And I think Charles is absolutely right. What we care about is how many founded cases of maltreatment are there with licensed foster parents within the state of Washington. They have to report this, but it really doesn't help us out much. And I think, Katie, you made that point more succinctly than I did.
Thank you all. I will definitely do that follow-up with DCYF, and if they don't, we'll make that a recommendation for the purposes of oversight and what we're looking for and what we think would be meaningful to the agency as well as Washington as a whole. Okay, so our next one is licensing more foster homes, and there are children in foster care. So again, this is language that's in the statute that established DCYF. What we've done here is we have gotten the actual ratio data that is requested by this measure. Part of what we wanted to make clear, though, and through discussions the board has had throughout the last several months, is that might this might tell us how many foster homes are licensed and whether or not that's the availability is for children that need placement, but we're recognizing that there's more specialized placement some children need than just a licensed foster home. So the first part of this, we cover what the measure is requesting us to cover, but then we do go into a little bit more nuance, I believe, about the measure itself. So this is reflected again further in the report when we do cover the hotel, the exceptional placements data itself and seeing the increase in that. So we reference it later, but we do cover here that for DCYF, a recommendation for a more meaningful measure would really be to look at not just how many licensed foster homes there are, but what is the capacity of placements for the need itself. So breaking that down further into need for, we've heard about the exceptional placements in those therapeutic foster homes or other identified specialized placement opportunities. So having the agency report out on that, as well as looking at licensed kinship caregivers. So identifying that that's always preferred placement. And so continuing to report on that, which the agency does, but we did get some more data for this report on the percentage of children placed in kinship care. So that's a major, I would say, part of this measure is to say, okay, they're measuring that, but is that as meaningful or reflective of the state of foster care today or to child welfare today as it might have been in its original intent? Katie.
You got it exactly, Krista. As you were talking, I'm like, oh, I'll put my hand down. But exactly, are these number of licensed beds the appropriate beds for the population we're seeing, or are we seeing a large number of beds, for example, for adoptable infants, which is actually not a helpful increase at all? So would love to see that broken down more.
Great. Representative Dent.
Thank you, Krista. So, you know, I think we have a lot of unanswered questions in this because so we want to increase, we want more foster parents and foster children, and I get that. But one of the things I hear from potential foster parents is the difficulty of becoming licensed. And I wonder if we shouldn't look at that in the year, you know, to see if the process can be streamlined or if thorough enough, but and just kind of review that process to where we could support additional foster parents coming into the system. Because, you know, I do hear from people kind of on a regular basis. So I'm just wondering if that might not be something we should take a look at.
So it sounds like as far as in response to the measure as written and intended, because they have not, I mean, we do have, we do see that there are more licensed foster care beds for children in care. And that in 2004, there was also a goal set of having 2 licensed beds per child in care. So they haven't reached that goal, but we do see that the overall goal of stated in the legislation is there, but you're interested to know if there are barriers in place to more foster parents being licensed. Does that reflect also, we've talked about specialized therapeutic foster care that extends to that, why there's not more of those placements?
Yeah, I think it could. I think it could just extend over, you know, and I'm not saying that there's anything wrong, but I'm saying if we look at the whole licensing program, you know, kind of as the big picture, we might be able to find ways to increase our numbers and also the more therapeutic license foster care.
Okay. I'm going to put that as a note for follow-up to get more understanding of that landscape, because if there's work that DCYF's doing, I don't want to necessarily make that recommendation that they need to be doing that. Representative Sen.
Thanks, Krista. Yeah, I was just going to say that at our DCYF briefing Tuesday morning, they mentioned that the module for tracking foster parent applications is to be coming online shortly. So if we mention something on that, it probably gets to Representative Dent's point that they're making, you know, progress, and that has certainly been a negative thing, but that they're, you know, that is, and I don't know the date, but and then also, I don't know, since we have a COVID line, I know that there were in our in the payments for around different COVID related things, there were increases in payments to kinship providers and certainly to FFNs and things like that. And I don't know if it's worth noting that if we're also noting other COVID and other measures.
I know that's something that later on we have the measure about developing strategies that for foster parents to feel they're valued by the agency. And I think that was a note you had made about additional payments provided during the pandemic.
Okay.
Is that something that we also want to
I could
have?
remember. I think it fits somewhere.
Okay.
That's probably fine.
Okay. Okay. I will definitely add the portal though. You're right. That I've seen that too. The timelines for the application portal going live. Justice Bridge.
Yeah, my comment goes back a couple of remarks ago, comments ago, but having to do with appropriateness. I mean, this should not be just about numbers, quantitative numbers of twice the number of kids in foster care, but I think it was Representative Sandy who talked about, well, what's the population of the kids and what are the needs of the kids in foster care? And you know, I thought, describing in my head, I thought that's a nuance. It's not really, because we're talking about critical things here to avoid blowouts, to avoid runaways, to avoid trafficking for that matter. When we talk about the special needs and particular needs of LGBTQ kids, kids who have been trafficked. I mean, we had I don't know if it's still going on, but there was a pilot. We got a grant in King County to have specialized foster homes for kids who had been trafficked, so that we could avoid them running away and being trafficked again. Linguistic, race, ethnicity, culture. I mean, those are things that they should reflect, if we want twice as many of them, but it should reflect the quantitative, from a qualitative standpoint, the array of kids who are in care now, because as we know, in this list that I just reeled off, there are disproportionalities, as in a higher number of those kids than others.
Thank you. We will definitely make sure we emphasize that. Charles.
Thanks. I wonder, given this conversation, if we want to change our assessment to inconclusive, kind of like we did with the one above, where we didn't have the right measures that we thought were helpful. I think my original reason for raising my hand too was when I read that second paragraph and then I look at the chart, they seem to be contradictory, because the second paragraph we have fewer homes. Oh, it's homes, not beds. Okay, I see. So that's why. I was going to say the bed to child ratio shows more beds than children, but then it's fewer homes than children.
Yeah, and I mean, that's, again, some of the idiosyncrasies of the data is tricky, because that was, yeah, like a number of homes, but again, we're looking for a ratio here. So that's something we don't think is valuable. We can always take that out as well. That was more or less to say that the number is going up while the number of children are going down. So the ratio is going to be what they're looking for as far as what's available, what's not. But what does anyone else have thoughts on changing this to inconclusive? The only thing I will say,
I would keep it.
Yeah, I'm looking at it and it's also needs improvement, positive trend. I mean, that I could work on what's actually reflected there. But again, we're doing the performance status in relation to what we're mandated to report on. So I think that this might be reflective of what we see with the ratio of licensed foster homes to children out of care. But what we can do is make sure we emphasize that this isn't necessarily as meaningful of a measure as it might have been previously, with a new understanding of the needs of youth in care. Okay, I'm getting some head nods. So we'll keep it as is now, but we'll make sure to highlight that, you know, we're reporting on this because we kind of have to, but we're really thinking there's much more valuable data that should be used to assess DCYF's performance in this space. Ben.
I may have missed it, but does it say in the report how they measure that? Is it a point in time observation? They take a snapshot once a year and compare it to the number of kids that happen to be there? Is that how they do it, do you think?
That's a really good question. I know I have that. I don't think it's included in here, but since we're asking about it, it probably should be.
Yeah, well, because if they're just looking at it, say, once a year, it doesn't tell you anything about how many foster parents quit, and they may have really brought in a lot more foster parents who would be exiting within the same year, but the stock population of foster parents would look like it's consistent, even though a third of or more of them could be leaving every year.
Mhm. Good
So I
point.
mean,
Yeah.
I think the technique of measuring there is important for our purposes,
Okay.
as well as all the other things that other people said about the quality side.
So I will verify, yeah, the methodology of how this is calculated, so we can clarify that.
The longer we talk on this, the more I agree with Charles. I think we have some an inconclusive set of data here that maybe we don't have enough information yet. We have some, but not enough, because it would be hard to back this up if we were, going to defend our position.
I'm sorry, but I have to disagree on that. I mean, this is one of those areas that we have pushed so hard. We've been desperate for the department to, and the communities to step up, to, have more homes, to make things easier, to really put a priority on this. And we are seeing in every region, I mean, region 3 is a huge increase. Region 5, an enormous increase. I think that, there's a couple where it's down a little bit, but in these other areas, this is like massive. And so I think that it's, there's some good and some bad. I don't know. I would definitely want to recognize the progress. Is there still more to do? Absolutely. But this, I mean, that's some significant work, going from a 0.86 to a 166. I mean, that's double. And so I just, and we're getting closer, 1.83 in region 3 from 0.88. I mean, that's enormous. So I would hate to discount or not recognize those advancements.
Any other thoughts on that?
Good point, Rep. Sen.
Okay, I do want to, we're only on number 9. This is a little bit of a heartburn, but the thought this might happen. We're only on number 9. We are out of time. We have 2 minutes left.
Yeah.
What would the board like to do regarding reviewing? I believe there are 10 more outcome measures. And I just want to remind the board, we also are on a timeline. So we do need to submit this for final review and publication by mid-November. So it doesn't give us a whole lot of time. And I know all of you are busy and have quite a bit of other commitments. Do we want to try to find more time next week? But if that seems, I think there's assembly days next week too, so that might even be a major challenge. Or do we want to do online feedback? And what I can do is incorporate everyone's feedback. And obviously if there's 2 different thoughts, I can include those and ask the board to respond to that, or I can incorporate all edits, send it out. And if there's any major issues, we can schedule another short period of time to discuss those issues and move forward. So what are people's preference? I know we're short on time, so I don't want to not allow for this opportunity since there's so much valuable feedback, but I also want to make sure that we do it.
Chris, I would recommend that the board could send in any proposals or concerns they have with the balance of the report, but maybe we could send out a poll quickly and see how many could meet again, within the next few days to see if we could go over this. I think this in-person analysis of this report is good, and we all really want to put together a good report that the governors accept, and so I'm for doing. We can, for those that can't make it, send in information, but let's send out, if we could send out a poll to see how many could make it for another 2 hours to finish the report. I see Bobby's agreeing with me, so.
Okay, so what we can do is we can pull together a doodle poll after this afternoon, send it out to everyone in hopes that you can all respond to it by tomorrow, which I know is a quick turnaround, but hopefully it'll be quick because it would provide time just for next week likely. And then if we do have time that makes sense for majority board members can do it, we'll pull it together. But we can assess it based on those responses. Does that sound good? As far as the next step, at least to figure out what's best.
That sounds good to me.
Charles, did you have? Oh, I think you're muted, Charles, somehow. I'm not sure.
Sorry, double muted. I was going to suggest, could we use the same poll that we already responded to? Because I know that had a bunch of dates in the coming weeks.
That's a good point. We did ask for times for next week too. Yes, that would be a resource we have. If everyone filled out that poll, I believe we included times for next week as well. I know that some people are no longer available at those times, but we can start with that and look at those results and see if there's a majority of groups that have that, and we can send that time out. Lois?
I think that's a really great idea, Charles. In fact, that's what we were on the same page, but I wanted to take this time to thank Krista and Nicholas and the co-chairs for the work that's gone into the report so far. You guys have done a great job. So I just wanted to thank you so much.
Well, thank you very much. And thank you for everyone's feedback and high engagement. It makes us a really robust product. So I really appreciate that. Okay, so what we'll do is we'll look at that doodle poll, and if we find a time where most people said they were available, understanding that might have changed since that poll was taken, we will just send out that time. And if you are unable to make it, please work with us individually also to get that feedback, and we'll make sure I'll send everyone an updated version of this from today's feedback as well, so we can work from there. But yeah, we'll try and get this done as best as we can as a group in the next week or so. So
we will. Thank you for your hard work. Thank everybody for being here today. I appreciate all of you.
Thank you.
Thank you.
See you all soon.
Okay.